Welcome to Digital Mental Health Musings, a podcast series from the E-Mental Health in Practice initiative, providing health practitioners with the latest news and developments in digital mental health services and resources. MPRAC acknowledges the Turrbal and Yagara people, the traditional custodians of the land on which we bring you this conversation. We acknowledge elders past and present and honour their continuing connection to land, culture and community, and that it's these connections that are intertwined in Indigenous mental health and social and emotional well-being. We acknowledge the strength and resilience of all First Nations people and communities since colonisation of their unceded lands. Hello, welcome to this episode of Digital Mental Health Musings. So today I'm really pleased to be talking to some of the team from Orygen, who are behind the MOST digital mental health service. So MOST, which stands for Moderated Online Social Therapy, has been described as a groundbreaking digital therapy platform offering a blend of online and face-to-face therapy for young people experiencing mental ill health. So it merges quite a few things: real-time clinician-delivered web chat counselling, interactive user-directed online therapy, expert and peer moderation, and peer-to-peer social networking. So it's a pretty impressive platform that was designed to overcome the limitations of some of the first-generation online interventions. And now, with more than a decade of research behind it, the service has been helping young people make significant gains in their mental health recovery. So joining me to talk more about MOST is clinical psychologist and head of research at Orygen, Dr. Shane Cross. Welcome, Dr. Cross.
Hey, nice to be here.
And we're also joined by Savanah Whieldon, who's a peer work coordinator, lived experience worker, and project officer at Orygen. Welcome to you, Savanah.
Thanks.
So thanks both so much for joining me. We've heard a lot of buzz around MOST since first being rolled out across Victoria and Queensland. So the service is now expanding to more states across the country, and I'm pretty excited actually to learn more about the platform and how it works. So there's many innovative and unique aspects to the service that we will get into during our conversation. But one element that's pretty interesting is the social element. Can you tell us more about integrating social media in a therapeutic platform?
Yeah, absolutely. So I guess MOST was really envisioned to be a social network that made a difference. It's designed to be like a safe community where young people feel free to express themselves in the context of their mental health concerns. We've had it fed back to us quite a bit that it feels like a safe Facebook or a safe Twitter, which makes me feel like awesome, like we're doing our jobs. So I guess, surrounding the social network is a range of other services that young people can access on the platform, with things like clinical content through therapeutic journeys that kind of highlight each of the experiences that young people might be going through on their mental health journey, and careers support through our vocational team, and as well as one-on-one peer support that can be accessed as well. So with that, peer workers also moderate the community. So every post that comes through, peer workers are there commenting and supporting, and it's just a great time. So yeah, and then with that, we're all supported by the clinicians, obviously, who help moderate risk and also support young people one-on-one alongside their therapeutic journeys on the platform. So yeah, there's so many benefits in using the social network. Young people report having like an increased sense of belonging, feeling heard, validated, and being able to seek support from other people and people their age as well. And that the social network also aids in helping young people stay connected to their therapy journey on MOST, with young people and other moderators sharing content from the library of resources that we have, as well as through our Talk It Out feature, which is quite similar to like a crowdsourcing problem solving element. It's young people can post a problem that they're experiencing, and we'll kind of step them through all the elements of that, how they're feeling at the start, where they want to be feeling at the end of it, and then post it, and then other young people and peer workers can offer tips and strategies to help them work through that. So yeah, rather than young people accessing standalone supports that aren't like speaking to each other. Most is really designed to facilitate collaborative care and communication between our services and face-to-face service.
Wow, so it's really like taking the platforms that exist out there and that are being used and not always in healthy ways, and you've really built them into the platform. I really like that's like a safe Twitter, safe Facebook, safe Dr. Google as well. That Talk It Out feature really sounds like it's meeting that need for information and crowdsourced information. Like what would you guys do in this situation, and meeting that need in a much safer way.
Yeah, we're pretty big on safety. So like I kind of spoke about before, like the most clinical team monitors and responds to risks that may come up on the platform. So this can happen either through our social network or any messages that they have in a one-on-one space with either a clinician or a peer worker or a career consultant. So anything that risky comes up or any offensive communications are identified by like our automated safety check, and any indirect or direct contact with the most clinical team. So everything that comes through our clinicians are seeing, and all potentially risky content is reviewed daily, and appropriate clinical action is taken when that happens, such as like contacting a young person, conducting a risk assessment, safety planning, and then touching base with the face-to-face service. And any content that's tagged as risky or offensive is removed from the public view until it's reviewed by our team, which we meet a couple of times a day to go over that. And yeah, we like to offer peace of mind knowing that young people are being held in this space by our team to provide that really great wraparound support.
Wow, that's so comforting to know, because I think that's one of the big issues we're seeing with social media platforms is it's a great place to connect with people, but the safety mechanisms built in are, poor or sometimes non-existent. So it's so comforting to know what strong protocols are in place to make sure that risky content or, people at risk are identified and then managed appropriately. That's great. And so I'm really excited to talk more about the other features further along in the conversation, but I kind of want to, talk about the really extensive amount of research that's behind it, because that's really very extensive now, more than a decade's worth. Shane, can you tell us what kind of groups the intervention has been studied in so far? What kind of ages and conditions?
Yeah, sure. As Sav mentioned, most is quite a powerful and flexible platform. So it means that it can be used in many contexts, so many service environments, as well as for many different conditions. And so since about 2010, there's been numerous pilot studies, some RCTs, and a whole bunch of other research, including qualitative research, that really helps us understand how most can be valuable and effective for many different types of difficulties for young people 12 to 25. And even right now, there are trials going on as we speak, including in Australia and overseas, in the US, Netherlands, Canada, and Ireland. So it's got great power and flexibility to be adapted in that way for research purposes as well, to better understand how these sorts of interventions can assist young people. So it's been used for just about every condition you can think of, really, like psychosis, ultra high risk of psychosis, depression and anxiety, of course, being very common, social anxiety, even supports around vocational recovery, which is a really important issue, especially in youth mental health, to help get young people back on track. And suicide risk, suicidality, a really important set of previous and current trials looking into that. And really excitingly too, and I think often gets neglected in the broader mental health system, is direct support for parents and carers, and seeing how these digital interventions can also support them in helping their young people.
Wow, so it does sound incredibly flexible and adaptive to a lot of different groups.
Yeah, definitely. And our biggest RCT that was run and published a couple of years ago was called the Horizons Project. I mean, there was about 170 young people that were discharged from psychosis services after their first episode and given most as part of their recovery toolbox, and following them over an extensive period, it was 2 years. And we found that young people using most compared to those that weren't using most were far more likely to have gained employment or got back into education, which is a fantastic result. And importantly, it took a big burden off the health system, because 50% of those young people, 50% less likely, to visit an emergency department or be readmitted back to hospital just from using a powerful platform, as Sav described earlier. And then excitingly as well, the economic evaluations just being completed on that trial that showed that it's not only cost effective, but it's very likely to be cost saving, especially for young people with complex problems like that after being discharged from specialist services. So lots of research has been done and lots more to come.
Oh, wow. Those are some really, really promising outcomes, really exciting. Were there any other outcomes that you were looking at across those initial pilot studies? Can you share any of the other findings?
Yeah, I mean, in general, they all had slightly different aims, but what was in common is that we're always looking at, the way in which the platform's received by young people, how acceptable it is, their levels of satisfaction, the usability of the platform. We're also interested in just usage and engagement, like how long do people stick with these digital interventions? We know that many other interventions, digital apps, for example, for young people, find it really hard to be sticky, to stay with young people for more than a couple of weeks. And that, of course, like central to everything is this is safety and effectiveness as well. So, what we tend to find in general with the trials and even in the current rollout that we have is that about 95% of young people say they would recommend the platform to another young person.
Wow, that's really good.
Yeah, which is a pretty good endorsement, isn't it?
Yeah.
And that really excitingly as well, I mean, this is a really hard problem to crack, but sustained engagement in the platform are also looking quite good. Many young people, up to 70%, 70 to 80% of young people are still using the platform in one way or another 3 months later.
Wow.
We're seeing that also play out in the rollout, slightly lower numbers after 3 months, up to about a third, but that's still much better than what you would see typically in an app on an app store for young people, even for purporting to help with mental health and well-being.
Yes.
And then importantly, in all of those years of research, there hasn't been any serious incidences or adverse events. So, it's pretty safe, given that we're dealing with some risky clinical presentations, and that we do see significant improvements in depression, anxiety, psychological distress, and even well-being. We're quite interested in looking at sort of the positive health benefits as well as, reducing the negative symptoms. And excitingly, we're about to embark on an RCT toward the end of the year. Recently received an NH and MRC partnership grant to look at how most is working in the real world in a more extensive trial. So that's going to be
fantastic,
exciting to report back on in the future.
Yes, watch this space. That sounds like a really exciting trial. But I really love the points you made about the engagement, because that is a huge problem we see across the sector. Is people, are people getting the kind of dosage they need of the digital, relevant service to get an outcome? And I guess we also see the same kind of problem in face-to-face care, is that, people drop out after a couple of sessions. People don't engage for long enough to get the, necessary benefit of the treatment or the intervention. So those are really promising numbers that people are still using it down the track. And I think, don't quote me on this one, but I think in terms of mental health apps, there was some just shockingly low number of people still using apps, even a few days after they downloaded, like something terribly low.
2.3% or something, wasn't it?
Yeah. A week after they've downloaded it. So people continuing to use something like this even months down the track is incredible. I think it speaks a lot to the work you guys have done to listen to the needs of the users.
Yeah, and I think the power of bringing the best of digital technology and the portability of that with human support, as Sav outlined. I mean, that combination is quite important, and you see this not just in most, but in many other digital interventions where human-supported digital interventions are, tend to have much better engagement and outcomes than those that don't.
That nice integration of the human support and the digital. And I guess expanding on the point about the development of the service, can you talk a little bit more about what type of people were actually involved in the development of the program? Like, what was the initial concept and how has that kind of changed over time compared to what we see as most today?
Yeah, sure. So Young people, clinicians, youth mental health service providers, and researchers have been involved in the co-development of MOST since its inception. We've recently estimated, I think, that there's been over 1,000 individual consultations and co-design sessions conducted throughout the development of MOST over its, 12-year history. The original concept in 2011, 2012 was to ultimately develop a novel, cost-effective, youth-friendly strategy to address problems associated with suboptimal recovery of young people after their first episode of psychosis. So yeah, that model brought together a multi-disciplinary team of clinical psychologists, a computer program, health informant experts, a web designer, a writer, and a graphic designer, which was then born MOST, so our moderated online social therapy, and that website aimed to integrate therapy modules with a private moderated social networking function. So fast forward to today, we're now at version 5, and it has undergone a number of iterations over the years, especially since it was rapidly translated from research into clinical service provision with funding from the Victorian government in 2020 for the COVID-19 response package. But arguably the core central concept, which is embodied in the term moderated online social therapy, has remained pretty stable, but we have made some changes to support the rollout. We've improved the interface and the user experience, which included a rebrand late last year, which we were all really excited to see, and the additions of comics as part of the content delivery. So yeah, we have created and launched an app for Android and iPhone, which came out in couple of weeks ago, I believe, so early June. And we've expanded the content and therapy journeys across the wider range of mental health and associated difficulties that young people can face. We increased the services offered, including the one-on-one support from clinicians, peer workers, and career consultants. And we introduced our Talk It Out feature on the community. But yeah, and then I guess at a face-to-face service level, we've integrated with services and adapted our service model to phase of care to plug gaps in the service system and extend the therapy hours for those young people who are currently in care. They would probably be the biggest ones, but most importantly, MOST has extended beyond clinical trials with the support from Victoria, Queensland, New South Wales, and ACT state governments. I think that's important to mention now, that we are now used in over 80 youth mental health services across 200 clinics, which is pretty amazing.
Wow, so it's been all systems go following the pandemic.
Oh, absolutely, yeah. And it's our team has grown to include engineers, software developers, user experience designers, young adult authors, creative writers. We have an illustrator who's been responsible for bringing MOST to life through the comics, and our lived experience team. We've played a huge role in how the way the community has been shaped, which is our social network. And young people have been involved at every stage of this, from research development and trials through to what MOST looks like now. So it really does feel like young people are on this journey with us, and it feels like that. When we announced, we've heard back, feedback, and people love to give feedback. And one of those things was, oh my gosh, we need an app. And so when we launched that a couple of weeks ago and we're all celebrating together, it does feel like we're on this journey with the young people, which is pretty special.
Yeah, no, I'm really impressed with the breadth of expertise that's been involved in the development of this platform. It sounds like you've worked really hard to translate research and the clinical knowledge into something that's usable and engaging and effective, which is a real challenge in this space. There's a lot of great knowledge and therapeutic approaches out there, but actually translating them into something that works digitally is really hard. No, that's really exciting. And the kind of co-design aspect with young people, I think, is fantastic. We just spoke with guests in a recent episode about the digital mental health standards and the importance of partnering with consumers in the design of a service. Can you tell us a little bit more about that, how you've worked with young people to co-design the program, their involvement?
Yeah, I can speak to a little bit, and I'll throw over to Shane, who is a bit more involved in the process. But we have actually just launched our dedicated youth advisory group that provides that advice and feedback on the platform developments, and that's made up of young people who have actually used most. They've been, service users, and then other young people across Queensland and New South Wales and Victoria who have a passion for digital mental health as well, and youth advocacy. So that's really amazing. And the peer work team have been involved in supporting that development of that youth advisory group as well, which has been really great. It's actually one of our previous peer workers who now leads that youth advisory team. So that's really awesome.
Wow.
Yeah, I'll throw to Shane.
Thanks, Sav. Yeah, and further to that, I mean, in the last couple of years, we've managed to recruit up to 7,000 young people on the platform through our partnerships with services. And so every 6 weeks, we send out all of those participants an opportunity to give us more information about, how they're faring, and to give us feedback about how they're finding the platform. And surprisingly, quite a large number of young people take the time to give us that feedback and to actually write some really good qualitative feedback, not just box ticking.
Mm-hmm.
And we did a recent review of that feedback because obviously it's very important. We want to learn what's working well and what needs to be improved in order to make the platform more effective and more engaging. We found that overall the feedback was at about 66% positive, and what young people really say when we synthesize that feedback is that they report most is caring and supportive, that it's a community and a place for connection, which is really pleasing to hear. And then importantly, they say that it's helpful and accessible, but they also quite often report that they feel like the platform supports their own autonomy. And I think for those of you and clinicians listening, working with young people, I think that's a really important concept. Young people learning to exercise their own autonomy and learning how to do that and regulate that in a safe space, as Sav mentioned before, with our supports. So that the platform's really written with that respect and that promotion of autonomy in mind as a really important sort of engagement mechanism. And then there's just lots of other general positive feedback. But we also get about 19% of feedback that speaks explicitly to things that could be better, some improvements, and lots of requests for additional content. I mean, we've got quite a lot of content on most, but there's so much more that young people feel like they could benefit from, and when we actively work on that as well. Young people would love clinicians to be available 24/7. And, as far as resourcing goes, you can imagine that's quite challenging. We are available quite often, but not 24/7. And young people really wish that was available to them. And just lots of improvements and suggestions and great feature ideas for platform navigation and finding things and things working a little bit more seamlessly. But we do get about 5% of negative feedback. Some young people do tell us directly, look, it's not what they thought it would be, that they really, after having tried it, they really want to speak with a face-to-face therapist right now. And that's totally appropriate as well. So we do get a range of feedback, and we value that feedback.
And we've encountered that kind of feedback in discussions with other services as well, that people have tried it and found out that, actually this isn't for me, and I actually do need someone to chat to face to face. And what a great thing to find out that I've actually worked out what I need more specifically.
Yeah, definitely.
So I wanted to also kind of ask in the development of MOST. I mentioned that earlier on that it's kind of some of its goals have been to overcome some of the limitations and barriers that other first wave interventions encountered. Can you tell us a bit about some of those barriers that MOST has looked to overcome and how it's been able to do that? And also if, the research actually told you anything about, the impact then on outcomes.
Yeah, it's a big question, isn't it? So the way we see it, the way I see it anyway, is that we've got a bit of a double whammy here. We're trying to improve the engagement rates of digital interventions for young people, which historically, as you know, can be quite low. And then at the same time, increase the effectiveness of these things for a wider number of people. But then we're also squarely focused on improving the whole mental health service system for young people. And so the platform, as Sav has outlined earlier, doesn't just sit in isolation. It actually lives within services. And that's really important because we know from lots of reviews, including the most recent Royal Commission in Victoria, that the mental health system in general and the youth mental health system in particular is under tremendous stress, not just from the perspective of young people, but for those clinicians that work within it. We know that it's really hard for young people to access care. I mean, especially if you're in regional and rural areas. We know that even if you get into care, you can be waiting weeks, if not months, to actually see somebody face to face. And that if you're a clinician working in one of those systems, you know that that puts tremendous pressure on the workforce because you're there to help young people and feel like it's very hard to keep up with that demand. And then, you know, once young people are in and they're connected and they're seeing someone, it's quite a challenge to keep them engaged, as you mentioned before, Tanya, and to keep them sticking with the therapy and to try to prevent premature dropout or discharge, especially for those that have more significant difficulty. So, you know, most is sort of designed to really add value there and to really provide that option for young people while they're waiting. We find that the vast majority of our users right now are in that waiting period, especially in headspace services, and getting great value from getting something in that time, something that's evidence-based and supportive. Also, there's the use, and Sav will go into this a little bit later, around how clinicians can use it in their face-to-face sessions to sort of extend the therapy hour, we might say, and provide support between sessions and after. And then also for those where we're looking to discharge young people, being a clinician myself, I know sometimes it can be a bit unsatisfactory discharging young people to nothing. So knowing that there's something to discharge young people to is almost like a step down option, can be really powerful as well. But you know, implementing these things is challenging in the real world. It's difficult, it's hard. Services are busy and overwhelmed, like we just mentioned. And, you know, even history has told us this, even the highest quality evidence-based interventions can fail to really get taken up in real world services because of these issues. So, you know, a big part of our team actually is the implementation team. They do a fantastic job going out directly to services, supporting those services, those clinicians to integrate most into their services and make it available to the young people who might want it. And we work really closely with those services, get feedback from those clinicians about how, you know, not just the platform, but the platform in their processes can be improved and streamlined. And with the help of those partnerships and then the great work of the implementation team and our services that are using most, we're seeing referral rates steadily tick up over time, which is really great to see. So it takes a massive team effort to overcome a lot of those challenges. We haven't solved them all, but we're learning definitely all the time.
Yeah, it definitely sounds like you're addressing it from multiple angles, because there's the problems with the, you know, the user uptake and engagement and dropout. Then there's the kind of the human factors at the end of the clinician end of like, well, how do we integrate this ourselves and how motivated are we to refer? And then there's the kind of the bigger health system kind of issue as well, about where it actually sits. So it sounds like you're really tackling a lot of those issues, because there's, you know, definitely a lot of issues with digital services being a bit piecemeal and siloed off and not well integrated. That they're great, they're fantastic, but that's very hard to integrate it into the existing system.
Yep. Definitely. So we think that's the best way in which to get these things used, is to integrate it into the system with challenges, yes, but we think working together we can really over time help overcome
get
them.
there. Yeah. So I'd like to dive in and take a bit of a closer look at the other individual components of the program. I know we spoke a bit about the social networking element. Can you take us through the other elements? I'm sure a lot of health practitioners and clinicians out there would love to hear about, you know, what's actually inside the program. So the user-directed therapy component, the one-to-one support, what else is inside there?
Yeah, so I mean, our one-to-one support will look a little bit different depending on who you're reaching out to. So it's peer work, you'll be getting, you know, your lived experience, you know, a bunch of young people who have that shared experience of navigating youth mental health services across the states, and what it's like to just be a young person in this day and age. And then we have our career consultants, where you can reach out to them, whether you're kind of thinking about wanting to start to get into work or study, or you're in it and you need some support around it, or you're trying to figure out where the hell am I going with it. You know, they're really great to reach out, and just a fountain of knowledge. We'll really admire what they do. And then we have our clinicians, who their one-on-one support typically looks like support through our tailored therapy journeys, which are the self-guided journeys that are based on really solid clinical approaches. So we're talking about the principles of like CBT, acceptance, commitment therapy, mindfulness-based cognitive therapy, as well, where young people can guide themselves through that evidence-based treatment for things like social anxiety, generalized anxiety, depression, and social functioning. All these journeys that we speak of are presented as activities, strategies, comics, and content that young people can work on in their own time. And they're targeted based on the answers given during onboarding, or a most clinician or a face-to-face clinician can assign them as well. Yeah, and that kind of turns into our personal library of tools that the young person can build on their time on the platform. So they can save things throughout those journeys that they find really useful or provoke a lot of thought, or they want to sit with a little bit more. And so they add it to their toolkit of therapy skills that they can draw on in difficult moments, while building their skills and confidence for future resilience.
Excellent. So it sounds like there's a few different ways through it, and a few things they can pick and choose from depending on their needs, or depending on the needs identified by a most clinician.
Yeah, and quite often we see, like, we'll start them off on one journey, and then we'll, throughout their engagement on the platform, like, they could go, oh, but like, I could really use some support with this or this, and that can just be swapped over, and they can focus on that journey for a while, and then perhaps go back to the other one if they want. Yeah, we're really flexible.
Mm-hmm. And in terms of how the kind of whole program works, the user journey, how might young people experiencing ill mental health, first come to know about most or come into contact with the program, and what might that journey through it look like?
Yeah, so most is in selected Headspace and state-based specialist services across Victoria, Queensland, New South Wales, and the ACT. So a young person accessing these services is typically invited to sign up to most by the service. So that can either be a clinician or an admin officer. They then would receive a personalised link to sign up to the platform. They'd complete a super brief questionnaire that asks things about like their interests, strengths, and the kind of difficulties that they're experiencing. Then they land on the homepage and are provided with a recommended journey based on those answers they just provided us, and then are introduced to the community, encouraged to make their first post, and then they are also invited to receive support from a clinician to help guide them through. And that's when they can also reach out to peer support or career consultation and explore the therapy content.
Excellent. And in terms of how young people tend to then actually use it, have you got much from your research, or has the research kind of revealed, do they typically engage with all of those components? How long do they tend to engage with the program overall?
Yeah, it's a great question. So, like I mentioned before, there's been to date about 7,000 young people in these real world services. So we're learning a lot more in addition from what we learnt in the clinical trials that were conducted previously. And we can see that about half of young people are still using most 6 weeks later, which I think is a fantastic outcome. And even about a third are still using it after 12 weeks, like 3 months. And that pattern of use is different for different people, but there is use going on there. And as you asked earlier, like, not all young people use everything. It can be a bit much. About 10% engage with everything, which says a lot as well. But 95% engage with at least one component. And if we look at the social network, again, not everyone engages with that. About 60% of young people do, meaning that they've posted something or they've commented or they've reacted to something, which is great. But we even hear from young people who aren't interacting with it in the way that, we just described, that they're looking at the feed, they're learning from others, they're sort of passively involved, and when our clinicians are sort of speaking to them, we can't see that in our data, of course, but they're saying they're getting great value of just being a bit of a fly on the wall on that and building their confidence up to maybe one day contribute themselves. But we've had about 20,000 posts and comments on the community in the last couple of years, which is huge, isn't it? In terms of those therapy journeys Sav mentioned, again, like not everybody chooses to take up those therapy options for many reasons. Some of them are getting really good therapy in those services, but we get about 50% to 60% of young people, engaging in that. And about 70,000 therapy activities has been viewed by young people in that time too, which is quite large as well. And again, there's a range of therapy options. I think Sav mentioned some of them, but really our most popular pieces of content around managing low mood and depression. But then there's also some quite popular journeys around developing social skills, which I think is fantastic. Like it's rare to get those sorts of interventions in other places as freely as that. Social confidence around social anxiety too is a popular one, and sleep, adolescence and sleep. A lot of young people, we find that that's a really highly engaged journey, the sleep journey that we have. Clinicians reach out to everyone, as Sav mentioned, so we get at least a message or a phone call to every young person, and then we depend on what that young person wants or needs. About a third will go on to see a peer worker, and a third will go on to request a consult with a career consultant. So yeah, there's a range, as Sav mentioned before. It's such a flexible program, and there's such a range of needs for young people coming into the platform, from Headspace all the way through to specialist services. So yeah, you see that play out in the data.
I think one of the things that we do really well is we, young people's needs will change throughout their time with us, and we can kind of be there and meet them where they're at.
Yeah.
I think I don't have stats around it, but I think it's something that I can see because I'm on the platform every day. Is we'll have young people and they'll jump on and they'll share, and they'll kind of share like what they're experiencing, and then we'll kind of walk alongside them in that journey, and they'll be posting every couple of days, and we might get to around 6 or 8 weeks, and we might see them drop off a little bit, and we're like, oh yeah, that's okay, and then it could be 4, 6, 8 weeks later, and suddenly they're back on going, oh my God, guys, like I just want to share with you this win that I had. I've been 8 weeks free of self-harm, and I just want to thank you. Like, we see that quite a lot, and it really does make us it feels really good to be able to be there and hold that for young people when they need it.
Yes, it's like you've really created a safe, containing space, that like a persisting kind of space in their lives that they dip out of it and then come back to it later, because they want to connect and share. That's beautiful. And it really the thing that really strikes me is how flexible it is, and how the young people seem to be finding what they need in all the offerings, that it's not this one size fits all approach. It's offering the main things that young people might be looking for, and they're able to dip in and out. And I think, coming back to what you were saying earlier, Shane, about autonomy, it's helping them, give them a sense of agency and autonomy in their journey in terms of picking what they need and being channeled towards the interventions that they need at that point in time. So as a clinician, working in, I guess, a range of different contexts, can you share any tips about how clinicians could integrate most into their practice?
You to jump in on that one, Seth?
Yeah, I can. So yeah, we should start by, reminding listeners that most at the moment is only available through participating Headspace centres and specialist services. We've got a national implementation team that's really hands-on with those services, from training through to ongoing support, and they're getting to hear firsthand how clinicians are using the platform across all stages of care, right through to discharge planning. So I guess our tips would be to encourage most as a support before starting face-to-face treatment. It's available straight away and can help young people prepare to make the most out of the treatment. Recommend most between sessions. For example, using content that builds on what you're working on in your face-to-face time together, and so build their skills in order to enhance the effectiveness of our therapeutic work with young people. And we really want them to reflect on what we've discussed in their sessions with the clinicians, and in the long periods of time between sessions and after sessions are finished. Applying and integrating what is learned in sessions into daily life is ultimately the goal. So, for example, we can discuss how to respond to distress in session, but then what happens for a young person when they're back out in the real world? Like, how can they reinforce and practice skills to help them manage distress? Yeah, so there and then what they can access that will facilitate a new way to manage things that they're experiencing, and most can be seen as therapy companion between sessions, really, with the clinician and following an episode of care. And then we have incorporating most into discharge planning, so giving them connection to support after that face-to-face care has been received, and giving young people the resources to maintain the gains that they've made in their time with you, and that the safety net there to access appropriate care if there is some relapse or they encounter a fresh set of challenges that they want support with. And I guess just recommending young people use the community. It can be a really fantastic way to seek support from like-minded peers for when they need support, but also, they need support, but not necessarily a session with their clinician. It's just a really good sounding board and a place to just be in it with other people, I guess. And then utilizing the vocational support available is a really great way to add an extra element of something that maybe you don't have in your face-to-face service. Yeah, I think that pretty much.
So it's really using it to like extend the therapy, in the lead up, if there's a wait before being able to see someone throughout the therapy, and then post discharge, really at all points in the journey.
Yeah, 100%.
Mm-hmm. Oh, well, it's been, we're getting towards the end of the time that we have. So I kind of wanted to wrap up with just, congratulations, because this is, this platform is a really significant accomplishment. Big congrats to the team on bringing this together. Sounds like an incredible amount of work involved. What's on the horizon? What's next for most?
Lots, because like all high quality digital services, or high quality services for that matter, like most is constantly changing and improving for the better. So we sort of outlined the ways in which we do that, of course, but the app has been something that has just recently launched, and that's going to make a big difference in the way young people, we think, engage with the intervention and the platform. And beyond that, we're really looking to, refine the service model. We've learned quite a lot about just the variety of needs in the platform and how we can make that a bit more streamlined, adding more clinical content. And probably most importantly, our real aim is to make the platform far more personalised and make treatment far more precise by targeting, underlying mechanisms that sit beneath the problems people present with. So we're really excited to build a much more personalized experience in future. And, what's clear, and I'm sure many listening to this podcast will think, well, I can't get access to most at the moment. I would love to. We're really looking with our partners to expand the accessibility of most to many more young people. Firstly, yes, to other states around Australia, but there's clearly an opportunity and value for most in schools, most in universities, and even most just universally available in the general public. We're really looking at ways in which we can get supported to do that, and we'd love to be able to do that. We think it'd be obviously great value, but it's reflecting on all the work and talking with you and Sav, it is a massive achievement over 12 years, and there's so much more to do. There's been so many people involved in that journey, and there's been a lot of dedicated people doing that. But what's pleasing is that, we can see that it's making a real difference to young people. And we all really believe that young people deserve the best quality care that they can get. Maybe the system in some ways lets them down, and we're all, even those listening, are trying to play our part to improve that, to help young people get back on track and meet their potential. So, yeah.
No, those sound like exciting developments on the horizon, and definitely it's a considering how long it usually takes for research to be translated into clinical practice. You guys have done an unbelievable job getting it to where it is today in that amount of time. So I think in time it will, it sounds like big things coming in terms of rolling it out and making it more and more accessible over time.
Definitely.
Well, thank you guys so much for joining us. It's been fantastic to have a chat and hear about the program. And if there's any more information that people are wanting to find out about most, check the show notes. We'll add in any links to papers and things like that in the show notes. Thanks for joining us, Shane and Sav.
Thank you. See you.